Okay, we get all kinds of families from all walks, very poor to the very rich, and cancer doesn't really care much. So it's a family affair, you know, that you take care of the patient, but moms, dads, siblings, aunts, uncles, grandparents, friends, it all becomes a big family project.
In January, Mac was experiencing intermittent headaches, nausea, vomiting, which his pediatrician said was just a regular stomach bug. He had a routine eye exam, which we went to, and once his eyes were dilated, his eye doctor saw the pressure and immediately made arrangements for us to come here for an MRI.
Dan got diagnosed when he was 6 months old on October 2008. He was diagnosed in Florida with cardioplexus carcinoma. That's a type of brain tumor. They didn't give him no survival rate after surgery. They just gave him 1 more month to live after surgery.
When we got to the emergency room, he had the MRI and we were waiting, and both my husband and I knew it was not good when the doctor came in and shut the television off and shut the door and had tears in his eyes and said that your son has a very large mass on his brain. It was the scariest moment of our life.
He's been on treatment with chemo for 4 years already. Been doing chemos, doing different things. On March 25, 2011, they sent him home to pass because they say that they couldn't give him nothing else. We've been trying to research about doctors and trying to find other doctors around. We couldn't find nothing in Florida, nothing all over the United States. We tried St. Jude, we tried all of the major hospitals and non-major hospitals. Everybody declined his case.
Once they told us the grade and type of tumor, he has a grade 4 glioblastoma multiforme. Dr. Wolf told us at this time there are no known survivors, but he also said there's no reason to believe at this point Mac can't be the first. And that's how he treats everything. No matter what obstacle, he has a plan of attack and hope. And he's just been a miracle for us.
I had a call from Dana-Farber, and they told me that they couldn't do nothing else, but they knew a doctor that just moved to Boston, that is Dr. Wolf, that could do something for Jan. So he emailed the Dr. Wolf on Monday, and on Tuesday Dr. Wolf was calling us saying that he was the one that was going to take the case. So that was the light at the end of the tunnel.
Targeted therapy means that chemotherapy drugs or non-chemotherapy drugs, but medication is used to target specific elements of the tumor that are not there in the normal body, which makes it so much better to cure these diseases without hurting the normal body as much as we normally do with our non-targeted therapies, which always hurt the body. It is very common, known, and there are a lot of drugs out there and many people talk about it, yet within pediatrics it is rarely done. The concept is simple. You take the tumor, you analyze the tumor, you find out which targets are there, you pick the drug. The practice is very complicated.
The idea of having a more targeted, less toxic chemotherapy for Mac would be a dream come true for us. He has the short-term side effects of chemotherapy, the nausea, he gets tired, weakness, loss of appetite, loss of interest in eating, but we have no idea what the long-term side effects will be. So anything less toxic to improve and increase his length of life and quality of life is something that we can only dream of.
So he's been on treatment since August. He's been doing awesome. Like you can see, he's a normal boy, doing all his normal stuff. We did find a great doctor, Dr. Wolf. He's been taking care of him. We have no problems with him. He's been like the angel on our journey. We have great doctors.
The old methods don't work. The old protocol was to give a lot of patients the same treatment. All of the patients had the same disease. The whole point of personalized therapy is that it's different from patient to patient. There isn't a large number of patients. The whole point of the treatment of targeted is everybody gets a different treatment. We consider the diagnosis is different by their targets. We consider the treatments different. You can't pile them up all together. You cannot use the standard biostatistics. We have developed a way to analyze the outcome of a single patient and to learn from every single patient. Compiling that information gives us information about the treatment, about the diagnosis, about the link between certain targets and certain drugs. And that piece we were the first to publish, and we have moved on since that publication and have perfected the method. The improvement of the treatment with learning from patient to patient not only helps on the long run to say something about these drugs and publish it and tell it to all over the world, it also helps the individual patient.